Camila from True Dental Care, and I'm here to talk to you about how to prevent cavities in kids. So I've been very passionate about this because I have a lot of parents that come into the office and they're very surprised when their kids have cavities. They'll say, but my kid doesn't eat any candy, or I brush their teeth every night, or I brush their teeth every day. Why do they still get cavities? And I have a very simple answer and maybe complicated answer. So simple answer is that no one's immune to cavities. It's pretty easy for kids to get cavities. And we'll talk today about the 3 things that causes cavities and what you should know so that you can do everything in your power to prevent those cavities in kids. So think of it as a Venn diagram. So we'll go back to school a little bit. If you can picture, 3 overlapping circles where everything is its own entity, its own individual thing, but they're also influencing each other. And what you have is, number 1 is hygiene, number 2 is diet, and number 3 is genetics. So yes, we'll definitely touch base on the genetic portion. So let's talk about hygiene. Hygiene is how you're brushing, how we're taking care of their teeth, how often, and what we're using. So please check back on a video. We talked about flossing. I actually showed a flossing technique on my 4-year-old, my daughter Adeline, and there you can see exactly what I'm talking about when I talk about flossing a toddler's teeth. So with hygiene, let's talk about brushing. You want to brush twice a day. You want to brush in the morning and at night. At night is the most critical time. I tell all my parents that don't miss the nighttime, because overnight it's so easy for them to have a dry mouth, and that is what causes cavities in combination of everything they eat throughout the day. So basically you want to use toothpaste and a toothbrush, and what we will talk about in a separate video is how much of the toothpaste, what kind of toothpaste and all that, and I'll answer all your questions. And what we want to do is we want to brush in the morning and we want to brush at night. In the morning after breakfast, at night right before they go to bed. They do not eat or drink anything except water after you brush. So you want to, is it 2 minutes of brushing? I'm a parent of 2, and I just get in there for 30 seconds. I sing a song or I count, and we get about 30 seconds of brushing. When do you start brushing your baby's teeth is another important hot topic, and you definitely want to brush their teeth and their gums as soon as the tooth comes out. So they could be as young as 3 months. That's okay. Get in there, use a toothbrush, brush that little tooth. Then we talk about flossing. Now, when to floss your child's teeth. Again, we talked about it in that video, but it's typically around age 4. So hygiene is super, super critical. Now, kids older, that are 6 and older, when they're really good at rinsing and spitting, I say go ahead and use a mouth rinse. There's so many mouth rinses out there. We can go over which one to use, but that would be a good idea as an extra step in preventing cavities. So we talked about hygiene, so that's brushing and flossing. We talked about brushing in the morning and at night. Definitely don't miss the nighttime, no matter what. You're rushing out the door in the morning, you miss it, shoot, don't be hard on yourself. Get that nighttime brushing. In flossing, I typically say floss at night. Let's talk about diet. That is huge in toddlers. Diet, they're snacking constantly, and so that is where I ask a lot of questions. What are they snacking on? How often? What is their favorite food? And that's because we're not worried. Yes, of course we're worried about candy, but it's not the candy that really causes the cavities. It's also the carbs and what they snack on. Anything that comes in a packet, unless it's a fresh fruit, fresh vegetable, cheese, or yogurt, will have some form of a carbohydrate or a sugar that will cause cavities. The number one snack that kids eat and love and we don't think about because it's healthy for their bodies and their tummies is raisins. Raisins is a no-no as a snack because it's sticky and it's sweet. So it gets stuck in those grooves, it gets stuck in between the teeth, and it lingers and causes cavities. It's the number one that I'm always asking about because it's a misnomer. You think it's a great snack, good for the digestive system, but raisins, they're very sticky and they're very sweet. So that's what I typically say. I'm like, okay, sticky sweet stuff, avoid. Laffy Taffy, you know, anything that stays in the mouth for a long time, like lollipops, Jolly Ranchers, the hard candy, the gummies. I say no to that. Absolutely no. You know, we talk about vitamins. Chewable kinds is what I prefer. Liquid is what I prefer over the gummy kind because the gummies, again, sticky, they're sweet, they're always sweetened, they get stuck in those teeth, and that's where we see cavities. And another thing about diet, so I'm a mom of two, I have 2 toddlers. I totally get snacks and why they're so important for sanity purposes for everyone all around. So I give my kids snacks and they snack on goldfish and they snack on animal crackers sometimes, and then they want the really sweet stuff or the treats, right? We call them treats in the house. So if they want a treat and I pick something that washes away easily and doesn't stick to the teeth. So ice cream is a good option for a treat. You know, a muffin or anything that's not sticky. So things and I give them water right after, and they drink some water. It washes it all away as much as we can because it's unrealistic to brush after every snack. So that's what I do. Let's recap the diet. So let's talk about drinking. It's water. Focus on that water. Avoid juices and sodas and anything sweetened. If you must give them a little bit of juice, you know, when you're out and about, no more than once a day, 4 to 6 ounces maximum. 2, diet. So avoid sticky sweet stuff. That is the worst for their teeth. Avoid anything like lollipops that stays in the mouth for a long time, and avoid anything that will take them a long time to eat. Now let's talk about the third thing, which is genetics. And genetics is, you know, we always talk about, you know, mom or dad had really bad teeth. Does that mean the child will also have some bad teeth or cavities? And the answer to that, it's still all very dependent. Genetics plays a role in so many aspects, and what that is one of the most important things is the bacteria that causes the cavities. And typically, moms don't be mad at me, but typically they get that bad bacteria from the mom because we blow in the food before giving it to the baby. You know, if a pacifier falls, we lick it and we think we're cleaning it, and then we'll give it to the baby, or we'll test the food and then give it to the baby. So we're constantly, that's the way we're transferring the bacteria. They could of course still get it from dad, so but just be aware of that. And so there is the load of bacteria that can cause a cavity. So the higher the load of the bacteria, the higher the chances of cavities. There's also about teeth themselves. How soft are the teeth? That means they're going to be more prone to cavities if they're softer, and that could be genetics. And there's so many other things that are in the mouth that are out of our control. I get a lot of families, same household, same diet, and there's one child is prone to cavities and the other is not. And that's when you know that genetics is playing a role because of the variables. There's the proteins, the enzymes, the bacteria, the minerals, and so much in the saliva that we don't have any control over. So the only 2 things that you can control to prevent the cavities in kids is the diet and the hygiene. So focus on those 2 things from the beginning, from when they're babies, and that will help you prevent and decrease the chances of cavities. There you have it. Those are the typical 3 things I talk about when I talk about what causes cavities and how to prevent them. Don't forget to subscribe so that you can keep getting tips and tricks how to keep your teeth and your kids' teeth and everybody happy and healthy. Thank you.